that was the inaugural session of the 8th edition of APAC HealthTech Innovation Conclave. With this, I request eminent speakers for the second part of this conference, that is a panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0 technologies. And for that, I would like to invite eminent speakers from the hospital chain of Mumbai, Maharashtra. Let me invite Dr. Srivatsan Sridhar, Group Director and COO of Sir H.N. Reliance Foundation Hospital and Research Center. Can we have a huge round of applause for him, please? May I invite Santosh Marathe, Regional CEO, Western Region, Apollo Hospitals, to come on stage, please. A huge round of applause for him as well. May I invite Dr. Parag Rindani, CEO, Wockhardt Hospitals, to come on stage, please. Let me also invite Joy Chakraborty, COO, PD Hinduja Hospital and MRC. Let me also take this opportunity to invite Sankareswaran Jayaraj, Head Infrastructure Projects, Tata Trust, to come on stage, please. And also, I'll request again Bhupesh Arora from Schneider to join us for this panel discussion as well. So, without taking much time, let me first shoot the question to Dr. Srivatsan Sridhar. How do you think that the digitization is helping healthcare stakeholders in making buildings safer and where patient experiences and patient safety is paramount? You heard about how patient safety is important, as Chief Guest has said, and also Schneider speaker has said. So your thoughts on that? How do you think digitization is helping for healthcare stakeholders for making the hospital buildings safer and also enhancing patient experience? Your thoughts on that?
At the outside, would like to thank the organizers and the esteemed guests who have all come here. So it's all about how we design. So the quality by design concepts have been actually fairly established. And what we have found is when the automated BMS, that the building management solutions and all have been put in place, we always see there is an enough of traction which is always seen in the overall efficiency of the hospital. And this entails not only in the LEED certification, which is on the eco-friendly initiative. So it's always fairly deciphered that we build hospitals which are all like running for decades. So we have seen a lot of hospitals who have been there, which have been there for multiple decades. As a sustainability, we have to see the technology. We are combating the technological obsolescence and trying to build the hospitals of the future. So that's the first essence we would like to imbibe. Secondly, our speaker before the Snidler, they had spoken about the video analytics and also about the wonderful concepts in their space. So I think those all are very important when we embrace technologies at the start of it. We have also seen that whenever hospitals are building technologies, they always, as administrators, try to see where they can cut costs. So that's always been in the backdrop of their thought process. However, we try and see how we can see when we solve this jigsaw puzzle of getting the technology embraced, the efficiency being put in place. So that have been the concepts which we are trying to work on.
I really like the last part when you talked about that we have to embrace technology, there's no other option, but also we have to think about cost cutting, or how much cost effective it is. But I think it's a need of the hour. We have to invest in technology. There's no other way, no running away from that. Let me take a perspective from Mr. Santosh Marathe from Apollo Hospitals. So if you can just highlight some of the digital measures being adopted for patient care in your hospital chain. Maybe you can touch base upon the how your hospital is leveraging emerging technologies like maybe blockchain or robotics or video analytics, AR, VR. Your thoughts on that, sir?
Firstly, thank you for the invite. I think interesting topic, and I think most of the solutions in healthcare are getting IT enabled. And COVID was a big change element, as we all understand. The manner in how healthcare is getting provided and availed, both have undergone a radical change in terms of this thing. Three important points: how Apollo has done some meaningful ways of adopting technology. One is definitely a lot of things have happened in patient accessibility. Lot of virtual solutions, lot of access solutions are available to the patient on a remote basis now. So as contactless solutions, as we talked during the COVID time, I think these solutions are here to stay. We are seeing a lot of integrated solution, whether it is e-ICUs that we talk about, e-ecos that we talk about, e-ECGs that we talk about, extended connected care that we talk about in terms of critical command centers, which are hosted by the hospital within the vicinity. So that accessibility has been a huge plus. Handheld apps like 24/7, what Apollo has been a changeover in terms of giving access pan India, outside India, to anybody who can have an access across the board. And one of the larger advantage for a group like Apollo with 77 hospitals, it gives access to all our senior clinicians across the spectrum. So anybody sitting in Chennai can have an access to the most experienced consultant sitting out of Delhi. So this has really brought overall patient care nearer to the overall thing. So patient access definitely has been one of the throughput which we are looking from Apollo's point of view. The second important change what we are seeing in healthcare is empowering the patients. I think the whole role model and healthcare delivery system is moving towards ambulatory care. Daycare is one of the concepts which is evolving very radically and strongly. And there is a lot of empowerment which is being given to the patient in terms of having access to their patient health record, having access and getting into a sequential reporting and looking at this thing. As Principal Secretary very rightly said, we are getting into a converged database. I think no longer you can work in isolations and islands. So once when this kind of public-private initiatives happen with people having access, and there is a lot of transient population who gets access to healthcare, whether he is in Delhi, Calcutta or Mumbai in terms of this thing, having one medical record and having a trail of sequential reporting is a big plus in terms of this thing. And more importantly, you don't have to do overlaying of diagnostics over and over again. So I think with standardization of most of the practices with lab and other things, there can be a meaningful way to accept a diagnostic being done by any other hospital. So that is one of the sea change what we are seeing from an overall point of view and empowering the patient from that point of view. The second paradigm shift, obviously, as I talked earlier, is the shift towards ambulatory care. There are a lot of home devices. Obviously, with FDA approvals and everything, I think it's a little fragmented market out there still, but it's becoming a little bit more matured in terms of meaningful ways where the patient and their families can be empowered in a meaningful way to take care of their own prognosis in terms of what needs to be done. The third important thing as a concept within Apollo also what we are trying to do is a concept of behavioral clustering. So what this means, and as I think Principal Secretary also touched upon that particular thing, is to create cohorts of individual disease profile. So in a meaningful way, that video also what example was given, I think in a meaningful way, if you could start defining clinical pathways for a diabetic population, then in a meaningful way, we can start capturing it in a much more appropriate manner. And the whole paradigm shift again is getting into the wellness management rather than the illness management part of it. So this is one important aspect where with that kind of data registry which is being created, in a meaningful way, you can create disease profile, look at clinical pathways where the interventions can be done early on. And one of the meaningful way how Apollo has done it quite smartly is all our HIS is integrated with what we call as is clinical decision support system. So we have alerts which are being given to the doctors, to the pharmacologists, to the individual people where drug-to-drug reactions or clinical pathway compliance, those kind of alerts are being given on a real-time basis. So in most of the cases, unfortunately, you end up doing postmortem, but this kind of real-time information really gives a good helping and aiding tool to the clinicians, to the care providers, to use technology in a much more meaningful way. So these are a few of the aspects which we do within Apollo.
Right, right. As you've rightly said, we all accept that COVID has been the game changer and how drastically things have changed in the span of 2 years. You talked about integrated solutions, converged database, home devices, and also real-time info and monitoring of those data. Quite important. Let me go to Dr. Parag Rindani from the Wockhardt hospitals. Maybe the same question, if I can ask you that, what are the digital measures being adopted by hospitals vis-a-vis the emerging technologies or newest technologies? Your thoughts on that?
So primarily, most organizations adopt technology to fight either the problem which we are facing now, which is that no offense meant to the government here, but the issue is that costing is something that is badly breathing down our neck. Payers are being told that healthcare is an industry which is probably out to profiteer. And while many people may not agree with me, the fact remains that everybody needs to make a decent profit to be able to grow, to be able to invest further. It's nice to have more technology, but remember it costs, and therefore this cost has to be borne by somebody. Nonetheless, even before COVID, I can safely say that we have invested in technology because of another factor which puts pressure on the healthcare systems of today. Let's face the fact that every person in the room who doesn't have a nursing college to his or her credit obviously is facing problems with nursing attrition, with doctor attrition, and it's because we want to circumvent these problems that we put up this entire hospital information system so that we are able to minimize the potential for errors. Accreditation is an important driver in itself because, as you know, IRDA is putting pressure on organizations to get accredited so that you're able to get a higher percentage of payout. Let's not beguile ourselves into thinking that we don't want to serve a customer. We do want to serve a customer. And the more efficiently we can do that, the better. 2, 3 examples, classic examples. I think we spoke about the integrated building management system. The worst thing that you can do to your patient is to burn him alive, and to sort of send home a dead body and we've seen enough examples, whether it's politically motivated fires, whether it is fault-related fires within the system. The other important thing we've seen is that all said and done, a human being cannot react as fast as technology will enable the person. So way back in 2014, we invested heavily into an ICU monitoring system wherein everything that is around the patient was integrated with what we call the clinical decision-making support system, which allowed the triggers to come automatically, not depending on whether a nurse was able to see that trigger at that point in time or no. And I think one of the most important thing is that today, whether it's feedback, whether it's patient information, whether it's information to give back to the referring physician in the community, because we all understand that that's an important part of the continuum of care. I think what's very, very important is that we've managed to digitize that so that our patient engagement, our doctor connect with the community physicians has only increased. We would like to see more and more of that happening. We would like to see more and more of hospitals getting into that. But let's also understand that the Indian healthcare doesn't reside in urban India. We still have to look at Bharat. And for that, I think we should be extremely grateful to Prime Minister's initiative on the ABDM. I think just this morning we received some posters from ABDM because we are meeting up with them. So corporate hospitals are getting into it. But I think the crux is that the government has done taken huge steps to ensure that data integration happens. 10 years ago, we were looking at projects in Gujarat government and Maharashtra government to engage with them for NABH. And you'd be surprised to know that infant mortality, maternal mortality, even 10 years ago, had a Tata Consultancy Services software. I think it's the private ones that are actually on the back foot. I think we need to have our decisions better tailor-made, our MISs tailor-made. But I think clinical safety is where we've always focused on, and that's what I would say we've focused on, putting in more digital initiatives.
Right. Thank you so much, Dr. Parag. You talked about a very important aspect that it's not only when we talk about healthcare, let's not talk only about the urban India, but also the rural India, which is a huge sector, and how technology can help in that. You also talked about how government has taken huge steps in year past in terms of data integration. That has been also important. Let me take a different perspective from Joy Chakraborty, COO, PD Hinduja Hospital in MRC. Mr. Joy, you have heard the inaugural speakers, and till now you've heard, we're talking about resilient and sustainable healthcare infrastructure, hospital infrastructure. How do you think that technology can ensure that we build a comprehensive, resilient, and sustainable hospital ecosystem, if I may say so? Your thoughts on that?
Thank you very much for the invitation, and great to see many known faces here in the audience. And I remember in the inaugural presentation from Schneider, there was 4 elements which were touched upon. The first one was resilience, then patient-centric efficiency, and then the fourth one was, I remember, sustainability. So we spoke a lot about this sustainability and resilience, but let me talk about the other 2 elements which needs to be addressed, and that can be addressed only through technology, which is patient centricity. So Parag was talking about, all this comes with a cost. But let me tell you, some of this cost initially looks, huge, and we hesitate or we deliberate whether it needs to be done later or even now. And some of those examples I want to give you, when we are changing our hospital the electric fixtures like bulbs, and you are getting into LED to save electricity. We had a huge pressure on us on electricity bill, and the initial cost of getting that change was huge, and everybody was wondering whether it is the right decision. But we got a payback period which was very encouraging, and ultimately we have seen the success of it. I think again Schneider has installed in our hospital BMS solution. When you're doing a new operation theater project, the BMS solution was coming at a bomb, and at that time people were worried about, is it going to really give us the return? Now coming back to your question, answer to your question, let me tell you what you have not spoken, that already our honorable prime minister has committed for something like net zero by 2070. So if all of us in a concerted way need to go forward and we need to work, I think we need to address many things. It is not only the electricity, but it is in each and every aspect, whether it is patient care and how you can give the best possible care without compromising on certain elements. So how it can improve the patient satisfaction, patient care and outcome, I can tell you, we have normally in patient journey the four elements. The first, the pre-hospital care, then you have the hospital care or called intra-hospital care, post-hospital care, and certain care which you extend to the community who are not yet your prospective patients or your prospective clientele group. You can reach out to them, give them correct information, patient disease related information. Some of those Dr. Santosh Marathe has mentioned, but most of us, we try to address the pain or concern when a patient is in your hospital. And when the patient is in hospital, let me tell you, and I wish none of us we come across that kind of experience and stage. However, we are getting patients and we need to take care of them. So the first thing is the communication with them. So there are different communication method mode what can be improved by using technology. The second one, Mr. Navin Sana was talking about, that getting different information from the patient to assess and analyze their right condition, whether it is heart rate or whether it is the ECG or any kind of vital signs. So in our own hospital, we have installed it already, and we can capture. And the most important part, early sign for any risk related episodes. That means that a patient is likely to get some sorts of emergency situation, if they need to be taken to ICU or they need early intervention which can save life. So that is another area. I can talk about many things about the efficiency development with the help of artificial intelligence, with the help of voice. I could see one of the sponsors who is present here by using the voice technology through dictation, conversion. Those are the need of the hour, and which addresses the component of efficiency in the initial presentation. If you talk about the EMR, maintaining, managing records, again, Dr. He has mentioned from Apollo Hospital experience, where we can see the continuity of the care which can go on from one hospital to the other hospital for a patient without repeating the diagnostic test, and many things that can be addressed through technology. And one of my most favorite area is the diagnosis itself. Today when you do whether MRI, CT scan and all, you need to get a patient in a hospital setup where all these technologies are there. You need to get a patient to a qualified ophthalmologist to identify whether they have any eye related problem. But there are several and many applications through technology, whether it is artificial intelligence and all. You can get this diagnosis done even in the rural area where most of our population they live. And finally, coming to this patient engagement. If you are engaged, you are connected to your patient throughout their life cycle, I think you have done your part of it. A patient, they like it, doctors, they love it, and hospital, they enjoy it. And in that way, I can think technology can connect patients with the hospital, doctor with the patients and hospital, and the entire ecosystem can get benefited out of technology and its adaptation, its application, which is going to take our Indian healthcare delivery a long way.
Right, right. Thank you. Thank you. Talk about patient centricity, net zero, which is very important in terms of climate action and also diagnostics. And there's no running away from technology in terms of transforming healthcare. Thank you, uh, Joy Chakraborty. Now, let me take a different perspective from Sankareswaran Jayaraj from the Tata Trust. He's the head of infrastructure projects. Uh, Mr. Jayaraj, if I may ask you that we know that Tata Trust is working in terms of capacity building and enhancing infrastructure in the healthcare sector. Where do you see the gap? Because we have here policymakers are here, hospital digital transformation leaders are here, industry leaders are here. Where do you see the gaps are there, which should be addressed in terms of capacity building or improving infrastructure, hospital infrastructure? Your thoughts on that?
Yeah, to start with, customary thanks to the Schneider Electric and the APAC for organizing this and having me here. Let me take a clue from what Mr. Natesan has said. First of all, Tata Trust being a philanthropic organization, and our focus in the last 5 years or 6 years has been into affordable cancer care. We have been engaged with various governments, government of Assam, government of Jharkhand, even in Maharashtra, we are coming up with a cancer care hospital in Chandrapur in joint collaboration with government of Maharashtra. So our mandate in Tata Trust has been to take cancer care closer to the patients. Affordable, sustainable, technologically advanced cancer care solutions closer to the patients, most likely into the tier 2 and tier 3 cities. That is where all the challenges come. How do you make cancer care available to someone who's in the remote corner of Northeast? How would you make it sustainable? How do you make it technologically advanced and future proof as well? So you need to also consider into all the future developments which are happening in the field of AI, virtual reality, or digital integration in terms of data and software, energy management, all those things. So that is where actually we are uh, faced up with a lot of challenges. First of all, it starts with the space planning and design, and unless otherwise you are able to control the project cost, which is actually also going to play into the overall the fund available with the government, or what the money that we can pump in from Tata Trust. It's purely philanthropic, of course. So you start with the design, and then how do you uh, adopt all the technologically advanced features like building management systems, energy integration, and also, to a large extent, to with CCTV these days, you can also monitor motions, fire safety, automatic extinguishing systems. So these are all, a lot of technology which is also being built in, and also the space planning, and also the overall cost of construction. And finally, to make it sustainable, what are all the energy conservation measures that you are going to build in while designing, and whether you're looking at solar rooftop, or your, net zero, in terms of looking at not only the carbon emissions, and also recycling your water, and ensuring that you're not letting out any wastewater into the ecosystem, and you are able to optimize on the water and electricity and other costs, and also making it fire safe. That is also very important aspect of it. So it is the design, adopting technology, making it sustainable. That has been the challenges that we've been facing while putting up these hospitals in the remotest corners of the country. And COVID also has taught us a lot of lessons. And when we were mandated with setting up COVID hospitals, that time we didn't have any clue of what is COVID. The technology comes when there is a disruption, or the technology itself can be a disruptive technology. So adopting to the technology to the worst of the scenario, we were given a mandate to set up COVID hospitals in collaboration with government of India, and successfully we completed 7 COVID hospitals across the country during the worst conditions possible. And that is when all this technology, remote monitoring, remote control, managing your supply chain, everything, helped us a lot. And also, of course, we have also worked with Schneider Electric in a lot of our cancer hospitals, directly or indirectly. That is what I would sum it up.
Right.
Affordability, sustainability, and technologically advanced, futuristic hospitals. These are all the key words which throw challenges to people like me who build infrastructure.
Right, right. And I think connectivity is also a major thing which we should also address, because when you talk about taking the healthcare delivery to the last mile, especially in the unreachable places, connectivity is a major problem still today. I know 5G, 6G is onslaught is there, but I think still a long mile to go before we have that comprehensive model. But as you rightly said, these are the challenges. But again, technology can be a game changer, as you rightly mentioned. You talked about the COVID situation. We all have seen how telemedicine, which was like no one was quite eager to use telemedicine, how it became a game changer during the COVID time, not only in urban India, but rural and semi-rural areas as well. Thank you so much. I'll come back to you. Let's have a perspective from Bhupesh from Schneider. Bhupesh, you heard all of our speakers, eminent leaders from the hospital chains. You also, in your initial speech by Nikhil in the inaugural also, he talked about the connected system, moving towards a connected system. What, according to you, are the benefits of a connected infrastructure, uh, especially for a hospital or their everyday functioning? Your thoughts on that?
So, from my point of view, again, I heard all the panelists again. Technology can help a lot beyond the efficiency what we see. So today, I think we see a patient coming into a hospital primarily for a procedure or for an emergency care. But there are many activities around the patient which needs to be taken care in just enough time, and the availability of that infrastructure is really important. I think technology can help first improve the efficiency of those infrastructure availability to patient, while the fastest possible attention and care by the various stakeholders. Patient may be in a OT for a procedure, but there are a lot of things which happens pre-surgery or pre-procedure and post-surgery. So if this interconnectivity is designed in a way wherein the stakeholders who are supposed to act on a glimpse of a minute, they can do that. So in the room, when the patient is admitted, moving to the procedure room and then coming back to the room, there are plenty of stakeholders like nursing station, there are housekeeping activities, or the food areas, they need to be alerted the movement of the patient. So if that can be done automatically, the availability of the infrastructure for patient will be faster. The alertness of those stakeholders can be much faster. And then the respective stakeholders, be doctors, they'll only focus on their procedure, rest of the things will not. So we are not moving the papers, and the alerts are on the screens directly as the patient is moving from one room to another room inside the facility which is there. This helps us to first turn around those areas. Today, the hospitals, many hospitals are running out of the availability of these critical places to address more patients. Apart from patients' reactiveness, this technology can make the infrastructure available to serve more patients also in the same amount of time. I think that is where the technology is heading today, and BMS is not only a system primarily to take care of an HVAC, which was an original thought. All these interconnections of various infrastructure inside a facility can help the facilitation of all these movement for the patients in fastest possible time. Secondly, availability of the rooms like X-ray rooms, CT rooms are also really critical. So it's really important for the availability of those rooms so that the patient's movement is also aligned from that perspective. So you need to know today I may have 20 patients waiting for a procedure or a facility to be used, but how do we plan that is really very, very important and efficient, which is there. So I think all these becoming together is going to help a lot. And that is where the technology is playing a lot of role, primarily to turn around more number of patient services in the same amount of time and the same infrastructure which is going to be there.
Right. Monitoring, real-time analysis, and also tracking. That's the advantage of connected infrastructure, as pointed out by Bhupesh. I know we're at the end of this session, but quickly, I'll give you 20 seconds to all of you. One same question to all of you. Let's start with Dr. Srivatsan. Quickly, 20 seconds to you. Where do you see the future of India's healthcare story going in terms of building resilient and sustainable ecosystem? 20 seconds to you.
So it's all about EMR adoption, the electronic medical record adoptions by players and getting connected healthcare. So that's going to be the need of an hour. And on the end-to-end digitization, because as players, we have seen as healthcare players, it's very imperative that we have seen a lot of case scenarios when the patient is actually picked up from the home, say smart ambulance with the 5G enabled technology, and getting the AI enabled tools in the radiology to have faster diagnosis and getting a kind of a care pathway being established well in advance. And we have seen a lot of patient outcomes being improved. So that is the thing which we have seen a lot of benefit to the healthcare sector. And you will see a lot of the telemedicine going into a rejig of version 2.0, 3.0 coming in place, where the urban rural integrations will also come in place. So this is something which I wanted to envisage and bring into place our concepts.
Right. Thank you. Mr. Santosh, your thoughts on that?
So I think IT adaptability has been evolving quite rapidly. And I think based on the Prime Minister's vision, the digital highway that we are talking about, pathway in terms of integrating most of the interoperability between multiple players, that's one important element. And second is insurance penetration with Prime Minister Healthcare Scheme. I think definitely accessibility to healthcare will be standardized in the coming days in terms of this. 2 to 3 quick changes what we are seeing seamlessly happening into the overall thing is I think a lot of people will get into collaborations, which is very much important, because rather than wasting resources and abusing resources over a period of time, I think collaborative approach is something which will be a good one. And one fresh breath of air, what you can say, up till now the focus was always standardizing cost, but in the recent couple of years I think standardization of the care pathways is also evolving in the Indian subcontinent. So that will be a meaningful reference point where a care provided by a healthcare provider can be meaningfully compared with another healthcare provider. So I think these are good developments, and IT definitely will standardize and reduce the variability in care. As we always keep on saying, in healthcare, IT is a big plus in reducing the variability in healthcare.
Mr. Joy, your thoughts? Quickly, 20 seconds.
So I think last decade we have seen, or till last decade we have seen the technology and all were getting too much into medical care, medical part of it. But now it is coming 360 degree, the way my previous panelists have told, whether it is IT, whether it is even infrastructure, whether it is even non-clinical areas, in all aspects, it is going to get integrated more and more, and which will not make the healthcare affordable alone, it is also going to make it accessible. I think the healthcare entire ecosystem is going to go in a long way, and we are going to see better part of it. I think I'm in 28 seconds.
Thank you so much. Dr. Parag, your thoughts?
I wouldn't be so optimistic and utopian as my fellow panelists. I do see challenges. We've just launched NABH has just launched the digital health standards, which is just about a month ago. I do see, given the vagaries that we've got, doctors from CMC Vellore performing surgeries differently than, let's say, those who come from PGI Chandigarh. I think the vagaries will continue to remain. However, it's a fantastic move. Digital health standards, commonality of purpose, I think the moment we start levying similar pay for similar outcomes, I think that's when the whip will really get cracking.
Right. Quickly, Mr. Sankareswaran, Jayaraj.
Has always been our this thing, uh, taking affordable healthcare closer to the patients. I think the virtual reality and artificial intelligence and connectivity can play a great role. And as a fraternity of investors and the medical planners, so it is our duty to take healthcare closer to the patients rather than making patients travel to the tier one cities and then spending a lot of money in traveling and staying. Puts a lot of stress not only on the patients but also on the family members. The entire technology has to be used how to take healthcare closer to the patients.
Right. It reminds me of one famous saying in the governance sector. I think Naveen Sona sir will also agree to that. Uh, Policymakers tend to say that we should not see citizens coming to government offices. That should be the power of technology. We have seen that's happening in the banking sector. How many of us go to bank because because the services are there in the doorstep? As I rightly said, if we can improve the connectivity, uh, maybe 50% of patients should not go to hospital. This can be addressed in their home with technology, devices, and everything. Let's hope for that day can also come. I can see Naveen Suna sir smiling, and also Dr. Parag is smiling. But let's hope for the best. So I'll end this session with a take from Bhupesh from Schneider. Bhupesh, 20 seconds.
So from my perspective, the country's infrastructure will continue to expand, but we see technology helping to increase the efficiency of the existing infrastructure by at least 30-40% in terms of more patients to be served with the same infrastructure as well.
Right. Thank you so much. Can you have a huge round of applause for this wonderful panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0 technologies. We have only 1 minute with us. If you have any question, we can take 1 or 2 questions. I think we have a question. Can we have the mic there, please?
Is this technology is reducing the cost of hospital care? My question to panel.
Who wants to answer this?
So definitely, overall cost per patient, we may not be able to answer, sir. But I think overall scheme of things, cost of healthcare in the country will come down because of reduction of errors, because of speedier thing. But as far as individual cost, we have seen those patients where we prevented errors, definitely costs has come down.
Actually, I wanted to give the same answer, but if you have any particular technology on which you have question, I can give that case.
Screening of the patients because there is overcrowding. In hospitals like corporate hospitals, there is a different use of technology. So I want to know whether this type of technologies, that is cost, care, and computers, whether it is creating more complications or more
I'll
efficiency,
answer you. I'll
or
answer
reducing
you quickly.
increasing efficiency, reducing the cost of the care.
See, I'll answer you quickly. When you say cost, do you consider the benefit what you get out of this cost? When I'm talking about 1988 in Hinduja hospital, we started using Vacutainer for blood collection. So definitely it is a matter of cost for the patient. If you see that, okay, earlier you are doing at X, now it is X plus. But by using this and by spending more money, what is the benefit you have got? Now, if that benefit supersedes the cost, and in this case, yes, so it become much safer and better use. Definitely, it is a better in terms of application. Now, I'll take something very recent. Again, I'm very fascinated to talk about that technology. What Mr. Swana was talking about, that getting the patient vitals and predicting. Now, if you start using that, it is a costly affair. But in this way, if you can capture some early signs to stop a patient from getting into a ICU transfer or an attack, then definitely it is a benefit which is a much bigger in terms of value. So if you look at it in the holistic way, I'm sure no hospital, no one wants to have some sorts of elephant in the room, which is going to be a more expensive affair without thinking what benefit it is going to give.
So one more thing, I think on most elective surgeries, all hospitals in the city of Mumbai have probably shaved off at least a day of the stay, thereby reducing the cost, social cost, including packages costs have now come down across the city in terms of most elective surgeries. CABG's patients are now with minimal invasive surgery. Patients are going home on day 4, day 3. Total knee replacement patients are going home on day 3. So I think mostly this does lead to saving of the patient's cost as well. I'm talking about direct money out of the patient's pocket or the insurer's pocket.
Okay, I think we can take these questions offline also because next panel is ready. Thank you so much, all of you. Let me thank Dr. Srivatsan, Sridhar, Santosh, Marathe, Dr. Parag, Rindani, Joy Chakraborty, Sankareswaran, Jayaraj, and Bhupesh. Can we have a group photo with Naveen Sona, sir, please? Yes, I think Naveen sir stayed back to hear this panel, so we can have a group photo with all the speakers here today. Neha can also join us for the photo.